Well, welcome to this week's unit on renal and vascular pharmacology. In this unit, we're going to be talking primarily about the medications that we use to control renal function, as well as the medications that we use to control the vasculature, the arteries and veins in the body. These lectures are divided into 4 parts, and the first one is that of diuretics, which is our topic for this lecture. Okay. Your objectives for this particular section should be to list 3 clinical indications for diuretics, and you should also be able to describe the difference in action between osmotic and thiazide diuretics. Now, briefly, before we actually get into the diuretics themselves, just a quick review of A&P of the kidneys. If you recall, the kidneys produce urine, and urine formation is necessary for normal body function because it lets the blood reabsorb nutrients, water, and electrolytes. It gets rid of waste products that we no longer need in the body. These processes take place in what's called the functional unit of the kidney, those little things called the nephrons. As you may remember from A&P, each nephron has several segments. It includes a glomerulus, which is that round bulbular thing, the proximal convoluted tubule, the close twisted tubule, the loop of Henle, which is that big long loop, the distal convoluted tubule, which is the furthest twisted tubule away from the glomerulus, and then a collecting duct. So the urine gets produced in these nephrons through the process of filtration, reabsorption, and secretion. Now, if you remember, vitamins, amino acids, and electrolytes all can pass through the glomerulus, okay, and enter into the filtrate, which ultimately then is going to become urine. But large molecules like red blood cells and plasma proteins cannot pass through that membrane. Once the filtrate begins to go through the nephron, the rest of the renal tubules are where the reabsorption and secretions occurring. The proximal tubule, the loop of Henle, and the distal tubule contain really special transport systems that can pull ions out of the tubules and put them back into the blood. The most important of these ions that we talk about is that of sodium and the movement of sodium across those tubules. Okay, so now to kind of have a little refresher here on your renal function. If that was too quick for you, there is a nice section in your textbook too that you can use, or you can refer back to some of your other previous resources from other courses if you're having some difficulty with A&P. So we're going to start talking now about diuretics. And in looking at the diuretics, we're going to look at the conditions that they can treat, and we're going to focus on 2 types, osmotic diuretics and thiazide diuretics. There's a number of different types, but these are probably our most 2 common that you will see prescribed. So when we're talking, that first question is, what are some things that diuretics are used to treat? The 3 primary conditions are used to treat are that of anuria, or lack of urine formation, hypertension, high blood pressure, and chronic heart failure, which we discussed in our last unit. All of these conditions will usually end up with the symptom of edema, and so then the diuretic will also decrease edema in any condition where edema isn't. So let's look first at that category of osmotic diuretics. So osmotic diuretics are used to stimulate urine flow in the treatment of anuria, lack of urine, and oliguria, which is small amounts of urine. And it's used to treat them before irreversible renal damage occurs. If you remember what the word osmosis means, it's that it's dealing with that process of diffusion or of water across the semi-permeable membrane. So keep that in mind when we talk about how they work. Osmotic diuretics are compounds that can be filtered by the glomerulus but not reabsorbed by the renal tubules. So once these compounds are inside the circulation, they attract fluid from the tissues. So as they're rolling around the body, they're pulling in fluid from the tissues, and those water molecules are attaching to these compounds. Now what happens is these compounds go across the glomerulus, but once they're in there, they're trapped and they can't come back out through the renal tubules. As a result, they carry with them the water that they have attracted, and so the water and the compound is then excreted through the urine. This particular class of diuretics produces what we call a mild diuresis. So it's not a drastic one. It's just enough to pull some fluid off, and it won't mess up the electrolyte or the acid-base balance because it's not dealing with any of the transport of those ions that's happening in the tubules. So if you think of osmotic diuretics kind of like sponges, the sponges can go hold on to water and they can go into the glomerulus, but as they come down through the tubules, they can't come back out. And so all the water that is held in that sponge continues through the tubules and then comes out with the urine as it is excreted from the body. Commonly with these, the most common side effects, adverse effects that you will see are some nausea, dizziness, headache, and chills. A lot of those, again, are due to just the decrease in fluid volume that someone has to adjust to, and after a period of time, usually they subside. Now, if we go and start looking at that second category of diuretics that we talked about, they are thiazide and thiazide-like diuretics. For my purposes, you don't need to know the difference between thiazide and thiazide-like. Just remember that category of thiazide diuretics. Now, these diuretics are by far the biggest group of diuretics that we use in our clinical settings. They're widely used to treat that edema that we talked about that's associated with hypertension and chronic heart failure or renal disease. They're particularly useful in management of hypertension because they really do reduce the plasma volume. So as a result, less volume pushing against the walls of those vessels will decrease the blood pressure. With these particular medications, though, there's also a large amount of sodium that gets moved around. What happens is these particular medications, instead of working in the glomerulus, as we talked about with the osmotic diuretics, they are working by, as you can see in our picture here, regulating the transport of sodium ions across those tubules, and in particular the sodium-potassium exchange. So what ends up happening is the sodium stays in the filtrate, and along with it, water attaches to sodium and carries the water along out with it. So they are having an impact on our electrolyte balance. So it is one of the things we must be careful of, that we can see the electrolyte balance thrown off with people who are on these medications. But the great thing about these is because they are working in those tubules, and they have this transport mechanism of sodium, they can remove large amounts of water from the body. So they can very rapidly pull out significant amounts of fluids, greatly decreasing plasma volume. That's great, and when you need to get rid of a lot of fluid. However, there's a couple downsides of pulling out that much fluid. Number one, as you might also recall from your anatomy, physiology, and human disease, fluid helps your muscles and helps your muscle movements. So it's not surprising if someone is losing a lot of electrolytes and a lot of fluid, they may experience muscle spasms or muscle cramps. The biggest thing that we see though with people on thiazide diuretics is something called orthostatic hypotension. And orthostatic hypotension is that condition where someone, is sitting or lying down and they stand up and all of a sudden become dizzy. And that's because their body is not able to push fluid volume up to their brain quick enough. So that is a huge downside of people who are on thiazide diuretics. One of the things we do need to make sure we tell them is that they're going to need to watch it and probably move from a sitting to a standing or a lying to a standing position more slow than they used to do. They may also have an issue with kneeling or squatting for any period of time. So the biggest thing that we have with the diuretics as far as side effects is just that orthostatic hypotension. And then you can get some of the other things that we talked about, some of that nausea, some of that headache, and chills, the muscle cramps, those type of things going on too. Okay, so let's kind of look back at a little bit of a case study here and see how we're doing with the diuretics themselves. So Mr. Standing, he comes in and you see him in the office for a 6-month checkup, and his blood pressure is 160/90 millimeters of mercury, and his ankles are swollen. He tells you he takes a water pill, isosorbide. Okay. So here's my questions for you to think about. What could be the reasons Mr. Standing is taking a water pill? So thinking back through our clinical indications for diuretics, we're reasonable to say, okay, he's got swollen ankles, okay, he's probably had some edema, blood pressure 160/90, if you recall the normal 100 to 140/60/90, so that's up there a bit. So my guess is, he's probably been taking that because he's had some blood pressure, mild blood pressure issue going on there. So now, the doctor decides while he's there to change his medication to Benicar HCT. Now, why would that be? Why do you think he might change that around? Clue being, if you recall, Benicar was one of the medications on your drug summaries. So if you refer back to your drug summary on Benicar, why do you think he might go and change his medication to Benicar HCT from isosorbide? Well, in essence, it's what we talked about here. Isosorbide is an osmotic diuretic, and it pulls out water, but mildly. And he's been on it, and his blood pressure's still up a little bit, and his ankles are still swollen. So, my guess is the physician's going to say, you know what, I think we need to kick it into high gear and give you something that's going to pull out more fluid. In which case, Benicar HCT is hydrochlorothiazide, is a thiazide diuretic and will pull out more fluid than the osmotic will. And in the same time, you're going to probably need to educate Mr. Standing a little bit about his side effects. So what side effects might he experience and that you might need to go and talk with him about? I think probably the biggest one here is the orthostatic hypotension that we're going to have to warn him about, because this is probably going to be a drastic fluid change from what he did before. You might also want to let him know that it's normal that he's going to be going to the bathroom a lot. If he experiences, some of the other things, the dizziness, the nausea, and that, let you know. And then kind of judge and see, the doctor can kind of judge from there if he needs to adjust the dosage or not. So with that, we've covered our topic of diuretics. Again, you should be comfortable with the different types of diuretics, what they're used for, common side effects, and the big differences between osmotic and thiazide diuretics.